And good evening. Welcome back to blackdoctor.org, where wellness and culture connect. You are on with me, Dr. D, stepping forward with Dr. D. So, I'm your board certified podiatrist from Neighborhood Health, which is a federally qualified health center, providing care for all, regardless of immigration status or insurance. I am also the co founder of Sisters in Podiatry, a Facebook group that focuses on Black women in podiatry within the United States and the Caribbean, and your hostess with the mostest tonight. So, what is a podiatrist? We are medical and surgical specialists of the lower extremity, from bunions and hammer toes to the diabetic foot to fungus, reconstruction, and more. I created this monthly show as a platform for the Black community and those who support us to have a comfortable space to chat, listen, learn, and share. So grab your favorite beverage. My favorite beverage is here in my Talks with Dr. D mug, and we will begin. So I'm so excited because these are guests that I know personally and have worked with in some capacity. So I'll introduce our first guest. Our first guest is the lovely Dr. Labrina Bryant. She is from District Podiatry in DC, where her specialty is general foot and ankle care. Having chronic foot and ankle pain can cause problems to you, walking and moving and grooving, and she is your one-stop shop. She accepts most insurance plans and welcomes new patients. She does everything to handle all your foot and ankle needs. Welcome, Dr. Labrina Bryant, who's also my sorority sister of the Alpha Kappa Alpha sorority. Welcome.
Thank you for having me, Dr. Cordai.
You're welcome.
Pleasure.
Pleasure. My next guest always brings me joy because we were in school together and he was actually our class president. So, any of our podiatry friends watching this, here we go with Dr. Zaki Shabazz. Dr. Zaki Shabazz is a graduate of New York College of Podiatric Medicine, such as myself. He did his residency at Wyckoff Heights Hospital in Brooklyn, and he has affiliations with Innova Fair Oaks Hospital, and he's in private practice for Fair Oaks Podiatry and Sports Medicine. Welcome, Dr. Zaki Shabazz. We're not hearing you, so come off of mute, Zaki.
Apologies. Thank you for having me, Kodai.
You're welcome. He's also a member, I'll give a shout out to his frat brothers of the Kappa Alpha Psi Fraternity Incorporated.
Yo, yo.
And of course, we're back with my girl, the lovely Dr. Yolanda Ragland, aka the Queen of Toes. So if you watched our first episode, she was dynamic and we brought her back for several reasons, as you'll find out. She obtained her degree as well from the New York College of Podiatric Medicine and surgical training through the academic affiliate of Weill Medical College of Cornell University. She maintains a fabulous office on Park Avenue in New York City and in the Washington area of Bowie, Maryland. The focus of her practice is bunion and hammer toe correction, where her trade secret is the tiara toe. She feels her niche is African American women and supports all that they do. So we welcome Dr. Yolanda Ragland. Hi.
Hello, thank you so much for having me back on again. It is a pleasure to be on here with this lovely panel. And I just want to say that that academic affiliate of Weill Cornell Medical College is Wyckoff Heights Medical Center, where Zaki was my chief resident. So this guy is a powerhouse, and it is a pleasure being on with Dr. Bryan as well.
I feel all the love is so beautiful in here. I'm just like, okay. So today's topic is, hot girl summer. Everybody wants to be cute. Everybody is looking, especially in the Northeast. If you're in the Northeast and Northwest, when we get that temperature raise, we're out. We're putting on a sandal, the flip flop. Somebody's conveniently sick at work because they're going outside. And sometimes we're seeing some things where we're like, what is that? And people are coming in more now, I would say, to get a miracle. And one of the biggest things that we're seeing is fungus among us. So I'm going to ask the question. I'll throw it first to Dr. Shabazz. Zaki, when people hear about fungus, they have all kinds of things, especially people of color. They think dry skin and fungus are the same. I use Vaseline and it's not getting better. I'm like, no, sir, it's not. So can you give us a brief description of what, I'll let you take what nail fungus is, and Dr. Hatter, I'm going to ask you what skin fungus is. So Dr. Shabazz?
All right. Well, nail fungus, the medical term, we call it onychomycosis, which basically just means fungus of the nail or the toenail or fingernail. For us, by dealing with the toenails, fungus is around us. It's in the environment, and a person can get it from many ways, whether it's unfortunately a nail salon, whether within their own shoes, because fungus loves a warm, dark, wet environment, whether it's at the gym, whether it's at the swimming pool, the beaches. Trauma to the nail is a very common way, because the nail gets damaged. You may lift a little bit, you may bleed underneath the nail, and then sweat and dirt gets underneath, and it can cause that some discoloration, whether it's a yellowish or tannish or brownish appearance, sometimes some thickening. Sometimes you can have separation of the nail from the skin, and it can also be some brittleness. And so with that being said, a person would, maybe, look at their toenails over the winter. Many times they have them painted, so they don't really see many things. And then once they take their nail polish off and they're seeing some changes, that gets a person to thinking that, something must be going
It's
on.
time.
And many times, yes, it's time to go and seek professional help, whether it be the primary care doctor and the primary care.
Absolutely. Dr. Labrina Hatter Bryant, hi. So we talked about what nail fungus is. Can you describe what skin fungus is? Because again, people of color love to slap on oils. We assume we're just dry. And, cocoa butter and shea butter is magic and will fix everything. And we know that it's not. So tell us, what is skin fungus? What does that mean? What are the general terms? Because people are like, what's she talking about? Describe that to us.
Yes. So skin fungus is categorized as tinea pedis. It falls under the infectious disease portion of the discipline of medicine, because first of all, it is contagious. And the actual lay term is ringworm. So a lot of times people don't want to admit to having ringworm or fungus or anything like that, but it's highly contagious. You can spread it by sharing socks and shoes, walking on barefoot surfaces, walking on areas that are wet and very moist, wearing shoes without socks. The web spaces will get macerated and open up, and it can also have a concomitant
What does
infection.
macerated mean? Dr. Hatter Bryant, macerated. That's a big word. What does that mean?
Bacteria is basically an infection of the skin where bacteria is introduced in an opening or weakened part of the skin. So with tinea, which is also ringworm or the skin fungus, there has to be a break in the skin, exposure to poor hygiene. Like I said earlier, sharing of shoes and socks, wearing old socks, not wearing the proper football. Old socks, because to keep your feet healthy, you have to follow a specific foot health and hygiene regimen. And so basically all the areas of your body that sweat a lot need to be replaced every 6 months. So a lot of that hygiene, using soap. A lot of my patients say, oh, I use this particular kind that's a moisturizing cream. And I'm like, it's not a soap. You still have to clean. We wash our hands several times a day, but sometimes people don't even wash their feet once a day. And that will open you up to skin fungus.
Absolutely. So you're hearing all this great information. We want to know where you're from. I know I'm hailing from Jersey. Dr. Shabazz is hailing from the VA, and Dr. Hatter is hailing from DC area, and Dr. Yolanda is New York City all day. And we know that the Northeast, we're obnoxious. We love to break down where we're from, but we want to hear from our Miami folks, Atlanta, LA. We want to hear from Birmingham. We want to hear from the Chi-Town. We want to hear from everybody. We want to hear from the Caribbean. Big up to the massive. and we want to know where you're from. So put the chats in there and give a shout out. Dr. Ragland, question for you, my darling. So we talked about what your skin fungus. We talked about that, athlete's foot, another dermatitis, and we talked about nail fungus. Can you, without going into too much detail, because I'll have more questions, can you tell me? So people come in and like, oh my God, I have this. Can you tell me? I think I'll give you this question. Let's talk about nail fungus because this is a hot girl summer and we love to get our toes done. I love a pedicure. And there are people who are diehard for the pedicure, and sometimes we have to advise them accordingly. So you have a patient that comes in, and you diagnose. How do you diagnose them with nail fungus? And name me one or two treatments that you would do.
Okay, well, the first thing is appearance, but appearances, can be a little tricky because fungal nails mimic a lot of different things. As Dr. Zaki stated before, the nails can be discolored and amber colored, thicken. You'll have something we call subungual debris. It's like this powder or toe dust that's underneath the nail. It can look brownish. It could have striations or streaks of discoloration. Oftentimes, you can cut way past into the nail bed than what you typically can cut, and that's because the nail is already dead. So that's usually a telltale sign that we're dealing with some sort of nail fungal infection. And then ultimately, you do want to send a sample out to a pathology place or a lab so it can be viewed under microscope and get a definitive diagnosis as to what the precise organism might be.
Fantastic. I'm going to give this question to Dr. Hatter Bryant. So, Labrina, sometimes we see things and we think fungus, and sometimes it's not. Is there any type of way when a patient comes in and it's like, you know what, somebody's been telling me, I have, skin fungus for years and I've used everything. We'll talk about different treatments in a minute, but you hear that. Is there any way to diagnose really that it's tinea or athlete's foot versus something else?
Yes. So the number one thing I do is a skin biopsy. Sometimes I have to go even deeper to do an incisional biopsy where I go to the second or third layer. A lot of times people think they may have fungus, but it turns out it's eczema, it's psoriasis, it's some other type of allergic reaction. It's not always fungus. Just like when you test the toenails, as Dr. Yolanda Ragland was saying, sometimes it's not even fungus. Sometimes it's just a trauma nail, micro trauma. It can also be a psoriasis nail, or it could be a yeast or mold. So it's important to do a diagnostic testing to find out what it is. I see more now trauma nails coming in because most of the people will come in wearing 2 sizes too small and they wonder why their nails are 1 inch thick. And I take out my device and measure. They think they're a 9.5, but they're an 11. And all of that trauma, walking and bounding, will cause bleeding under the nail, and it'll give the appearance of a cellulitis or a contusion, but it's actually the ill-fitting shoe.
Because what they need is to get some foot surgery with Dr. Yolanda, Dr. Zaki, and myself and you, and be like, let's fix these toes. My audience, share this, audience. If you're watching this, you can share this on your social media, particularly on Facebook, so all of your friends and family, because we know you have it. You know about 5 people who got that crooked toe with that nail that looks crazy, or they've had dry skin for it since you were a kid, and you're like, they still got dry skin. You're like, what is this? So sometimes our males, the men in our lives, we love you, but sometimes you guys don't want to get stuff checked, and we're like, bringing you over to the other side, like, baby, let's check this out.
Mhm.
So share it with your family and friends. We appreciate that.
Definitely, definitely.
So
Another thing, you'll always have people that say, oh, they have that one black toe, and they've been ignoring and ignoring instead of, just taking the courage to go check it out.
absolutely.
You never know what it can be. It could be a metastasis. You don't know what it is, but don't ignore it.
Yes,
I
and
agree. Zaki?
I'll also just contribute too when it comes to causes and as well as diagnoses. By being in the Northeast here, we're in a very active area. We have a lot of folks, young and old, playing sports, recreational activities, uh, and so shoe wear with cleats, tennis shoes, let's say shoes, as Dr. Hatter Bryan was saying about being a size smaller than what it should be. So a lot of times that contributes to the trauma aspect of things. And so a person may have like a thickened nail, and we're seeing it, and it's like, okay, this could be just trauma where your nail has become thickened, and it may not be a fungus, or it can be a fungus. So with the testing that we do, can help to distinguish it. The other factor is by being skin of color. A lot of times patients, I've seen this a lot of times patients will come in and they'll have that black or dark streak within their nail. Okay. And even though it raises the senses for them to say, okay, is this a fungus, or could this be something more like maybe a melanoma or so? So, one of the things that I like is I have the privilege of practicing, with my wife, who's a dermatologist. So a lot of times we throw things back, forth with each other. And so most of the time it's a benign, melanin streak, or melaninic as they call it. But sometimes if a person is real anxious about it, we could still do a biopsy in order to rule things out. So in terms of things that would get people thinking about, do I have a fungus or not, a trauma nail, as Dr. Hatter Bryant was saying, versus having like that little mild darkened streak within the nail, because many times it could be within the fingernail as well. And it's just something that's benign, that's, amongst, darker skin tones, such as African Americans or others. So that's something else that can raise the attention, for patients.
So I'm going to interject. So number one, I know y'all, when you saw the sale, ladies, and you were like, ooh, these are Gucci. If you're a 9, you're not an 8. If you're a 10, you're not an 8.5, because these are the things that happen as we've been describing. Wear your size. Go to a podiatrist, get fitted, see what your real size is. Stop scrunching in the shoe. You're just making us money, but we're trying to prevent you from having some of these pathologies that are going on. And as you said, Zaki, I remember doing a paper in school with Dr. Harris, flashback, Yolanda, and we did it on melanonychia striata, seeing that people of color got dark pigmented nails, whether it was a hazy color or a thickened stripe. That usually, women usually try to paint over it, men, within reason, and we would get concerned about that. If you see it more in a Caucasian person, we'd be even more concerned, because usually it could indicate signs of cancer of the nail that we
Right.
won't get so much. So it was a great time, exactly what your wife said, shout out to her, that it's good to have a biopsy if there's any question, and particularly if your clientele is fair in complexion, I would definitely, make sure you're ruling out skin cancer. So my next question is, I'm gonna save you for after, because I know Dr. Yolanda has a fabulous line for of products that she's going to share. But okay, let's talk about. Let's go back to what you were talking about for skin, and then we'll hit nail. And then Yolanda, I'm going to let you take over, because I'd like you to highlight your products. Skin. So I know I see patients who come in, and I'm like, there can be mild skin fungus to severe skin fungus, where you're like, good Lord. And for those who are in our age group, whoever watched Martin, that episode where they had the thing, the jackhammer,
Myra, work on Myra. That was the line.
Myra, that's right.
Listen, if you are 35 plus, you saw that show, you remember it, and you're laughing. Some of y'all, they need to come in a little earlier. So, so I always like to make fun. It's a good memories, good talk. But Dr. Hatter Bryant, Labrina, so you have a patient who comes in and they have tinea pedis, athlete's foot, on the bottom of their foot. They tell you, I tried over the counter stuff, the Vaseline to whatever that they can see that's over the counter. what type of products do you, and let's use generic terms because I'm all about sponsorship. What kind of products do you recommend to your patients for skin fungus? And then Dr. Shabazz, I'm going to ask you about what kind of products you recommend for skin fungus as well. And then we'll talk about nail fungus. And then we're going to go to Dr. Ragland for her fabulous line that I think is something that we should all be using. But Dr. Hatter-Bryant, let's start with you first.
Okay, so it just depends on the severity. So moderate to severe infections, I would say that would be macerated web spaces, scaling on top, bottom, all around the foot. That type of infection coming into my office, first of all, I give them all of a sheet of tinea pedis foot care and foot instructions, and then I'll start them on an antifungal cream. I will also prescribe them an antifungal shampoo in which they would use as a body wash. They are to wash their feet twice a day before applying the cream twice a day. And at that point, I would then give them a 1 month oral antifungal and have them return in 1 month.
Interesting. Okay.
That's how I do the moderate to severe. If it's just mild, I'll just go with the cream and the shampoo for them to use as a soap twice a day. And I would have them to throw all of their socks away. And they get upset with me because they may have 200 pairs. And I tell them it still lives in the sock fiber. So unless you're willing to boil them in your pots to 400 degrees to kill the fungus, just buy a new pack of socks. Let's get rid of it and move on.
MoveOn.com, like my mother says. Zaki, what do you use for your athlete's foot? I guess I like the way that Dr. Hatter-Bryant broke it down. So your mild patients and then your moderate to severe patients, and then we'll go into the nail fungus for both of you.
Yeah. And it's a similar protocol, so for the mild, chronic type, it'll be prescription for lotrasone, which is clotrimazole with betamethasone. So it's like antifungal with a steroid combined, especially if a patient has like some associated itching or some of that erythema, which is like some redness, maybe some red papules or bumps. So I would do the clotrimazole with betamethasone or the lotrasone. If that didn't take care of things, then that's when, I'm usually thinking, okay, this person may have something else going on, which can be either an eczema or an atopic dermatitis or something like that. And that's where a skin biopsy would go into play. But so that's like my first line, with patients. Econazole is a pretty good antifungal as well, and they have it in gel, foam, as well as cream. So a lot of times I would also, do that for patients between the two. For that recalcitrant, just stubborn, more severe, as Dr. Hatter-Bryant was saying, I do give a person oral antifungals. So my go-to would be Lamisil or terbinafine. I'll put them on that for a month, along with them still using the antifungal cream in order to try to resolve things. So that's my, go-to for the boat. There's other things that I may do in case a person may not, if their insurance doesn't cover, then, there's like a line of products that I have within the office, Formula 7, at which I would, have towards a patient as well. But that is an ingredient, tonalphate, it's hit and miss, when it comes to, coverage for athlete's foot, which would be fungiform. And then the topical, they have, for nail fungus, which is the Formula 7. But that's my go-to for mild as well as for moderate to severe.
And we have one question in the audience. It says, how many of your patients have had success with cyclopirox? I'll take that question because I was just about to say that. So my mild patients, I really like cyclopirox. It comes in a gel, it comes in a cream. If you're sweaty Sam, you're going to get the gel. If you dry up, you're going to get the cream. Intradigital or between the toes fungus, I like patients to literally take betadine and go in there and clean in the morning and clean in the evening. Yolanda's like, yes, girl. And then I would recommend the cyclopirox gel. Patients who are moderate to severe, I agree with you. I try to keep it simple because sometimes patients are trying to figure out what to use. I like terbinafine as well. And I'll keep them on it for a month. Orals work in addition to if it's intradigital, the betadine baths and cyclopirox. I'm not a real fan of econazole. I don't mind naptipine, which is another option. Again, for those patients who are using insurance, sometimes the matter of what's covered, which sometimes can happen. So the answer to that would be that I have great success with cyclopirox, but as Dr. Hatter Bryant said, it's hygiene. I tell patients, spray your shoes out with Lysol at the end of the day, let them dry. They're like, what? I said, spray your shoes out with Lysol, even the little slippers we wear at home. Get your feet need air. A lot of people are like, oh, I wear my socks all day in the house. Your feet need to breathe. Give it air. And also, with socks, I prefer people as well if they can get new socks. If they can't, I tell them that they need to wash all their socks on the hottest temperature possible and dry them on the hottest temperature possible, and to use cotton breathes. I know a lot of us want to use nylon because of, nice clothing for work, but a lot of times that's a problem. In addition to that, I'm gonna give some shout outs. I see folks from Omaha, Nebraska. We see you. Florida. I grew up in Miami, so woo-hoo. Washington, D.C., PA checking in, the Boogie Down Bronx checking in, Cypress, Texas, Pennsylvania from Dr. Monique Gary. Her show precedes our show with the Touch Black Breast Cancer Alliance and their CEO, my dear friend, Ricky Fairley. So big up to my store. Yes, we see you. Chicago checking in, and Rahway, New Jersey. All right. We appreciate you guys checking in and watching us. It's fabulous. And Garland, Texas.
And can I shout out Candy K for knowing who Myra was? I just want to shout her out. She said, she put Myra exclamation point. And so Candy K, whoever you are, you're dope. I love you.
That's right. Myra. She's part of the podiatric world. We love her. And if you're looking at us like, what are they talking about? Please go and Google Martin and look up, I guess, Myra foot fungus or nail fungus. It'll probably come up. It might come up, and it'll be a funny show to watch, which you can identify us with. So let's switch to nail fungus now, and then we'll be getting into Dr. Yolanda's product. So now a patient has had a biopsy. It comes back that they have nail fungus. I know nail fungus can be dermatophytes, which is a big over classification that we use. And there's a variety of types of that, and also yeast that can come, something called candida. So Dr. Zaki, we'll start with you first. Zach, if you have a patient that has fungus, it comes back, and you say, okay, you're explaining to them, and you're going to list your 3 treatment options briefly. What, if it's mild, if it's moderate, and if it's severe? What are the options that you gave patients? And that same question will be to Dr. Hatter Bryant. Labrina, I'd like you to answer the same. And then I'm going to turn over to Dr. Yolanda Ragland for her line of care that she uses. So Zaki, go first.
All right. So the test comes back positive. We're dealing with onychomycosis and nail fungus. So I tell a patient, you have 3 options for treating, their nail fungus. In mild cases, I'll tell them, okay, we can do topical. And the topical can be, prescription based, which would be either a Jubilee or a Keratin, which are 2 of the better topical medicines through prescription. Not always covered by insurance, and that's the caveat with them, because they can be either have a high copay and or just a high out-of-pocket expense. If it wasn't covered, the patient had to pay out of pocket. But the benefit is that they're attainable to nail fungus. So I'm sorry, to a nail polish. So they could use one of those 2 medicines, Keratin or Jubilee, in conjunction with their nail polish. So I'll say, okay, we could just go with a topical in order to get rid of the nail fungus. And that's what would be like if you have like some mild discoloration, not much thickness going on, no separation of the nail, no brittleness or anything like that. For the more moderate to severe, then I like to do a combination of oral with topical. And that would be either taking Lamisil or terbinafine pills by mouth, which would be 1 pill a day for 90 days, along with the topical medicine that they can apply daily to the area. And if a person was come in, and because many times they'll come in and say, yeah, I used to use, pills in the past, and it, it helped, and I want to, use it again. Then we go with that. Or if a person is like, well, I want to use the pills again, but, you know, I'm not quite sure because of potential side effects when it, general side effects like that you can have. But the thing that they're focusing in on is I heard it could cause either kidney or liver issues. But it's really a drug-drug interaction that we're looking at, which is either a person taking anti-cholesterol medicines like the statins, lovastatin, atorvastatin, or the Zocor Lipitor, versus a person being on antidepressants. And so if they were hesitant about doing that, then that's when I'll bring up, laser to them about how that could be a potential option for treating their nail fungus, whether it was on the mild side, moderate, or severe side. If their mind was already made up and saying, I don't want to use, orals in order to treat their situation.
Thank you. Labrina, take over, my love.
Okay. So basically, I start out with biopsying the nails and I send them in. And it just depends if it's a mild, if it's a dermatophyte, mold, or yeast. So for mold and dermatophytes, which are basically the main fungus that people are infected with, I will go with the Lamisil, especially if there are more than 4 nails that are fungal. If it's a yeast, I will go with the diflucan. They'll take it once a week for 3 months. So that's how I treat my candida. And so a lot of times people are not aware if you have unchecked yeast in your body, it comes out in your fingernails and toenails. So ignoring yeast infection for men or women can come out in your fingernails and toenails. As far as when it's severe, so like all 10 of them, extensive, I usually will recommend the oral pills, but if they don't want to take it, I give them 3 options. The first option is watch and see, do nothing, let it come out on its own. The second option would be a topical, usually Jublia or the cyclopyrox. I like the Penlac, that's the brand name it was. I like that one a lot because that requires them to put it on every day for a week. And then once a week, they remove it all with alcohol. And I really like that one because a lot of people don't want to use medication. They don't want to undergo the blood draw for monitoring their liver function tests while taking the oral medications. So that's how I treat them. But I give them the reference of this. Your toenails should match your fingernails. So if they're not matching, there's a problem.
Interesting. I'll comment on that. I would say that I like for nail fungus mild. I like topical. Cyclopyrox is my favorite. I like Julia, but again, coverage issues for patients. Moderate, I like laser actually. I don't offer it where I am now, but when I practiced in New York City, that was an option. So laser causes no effect on the body unless you're just sensitive to the laser while it's happening. The amount of treatments vary based on the laser itself. I've gotten great success with it when it's a mild to moderate. Moderate to severe, I love orals. And I tell patients, I say, I can dip you in a medication. It's not going to work without something inside of your body. Orals aren't for everyone. Everyone needs blood work. Usually most of your medication that you take is processed in your liver or your kidneys. In this case, the orals are processed in your liver. So we ask for blood work, a liver function test to make sure that kidney is moving. And while on the oral medications, you cannot drink. Sometimes we get people like we've talked about your mama, but you cannot drink while you are on the medication. You might get away with it once. That key, I know you're laughing, but you know I'm right? You might get away with it.
And a lot of patients, they bring that up, and I tell them, I was like, well, really with any medicine you take, you shouldn't drink.
You shouldn't drink, but definitely with this one, you shouldn't drink.
So I was like, if you do, just don't, overindulge. You know,
See, I'm not like
pretty
that.
much
I'm a
what I'm
stickler because I'm like, you might get away with it once or twice, but how you might end up in the ER. And my response is, yes, you are in the ER. So I like that, but that works for me, the orals, and obviously in the way that the two of you discussed. So those are great. Those are products that, we use. But I love that Dr. Ragland said, bump that. Yes, I can use that, but I have some treatment options for patients as well that should be used. And you know what? I'm not even going to say anymore. Dr. Ragland, let us hear about your fabulous products that you have.
Okay, well, thank you so much for allowing me to talk about my products, but I really do, it's all about information. Mm-hmm. So I just want you to know that I do have a background from NIH. I spent 5 years in dermatology research. And so there's a lot that I feel like even as professionals might not even know. There's these little snippets that we don't know. And before I start talking about my nail product, because it does have everything to do with the nail product. So there are two types of people in the world. There are people that get fungal infections, and there are people that don't. There are studies out there that show that they had college students trudge through pools of fungal water. And if these people did not have any history of having a fungal infection, they would not get the infection. So there's an enzyme in you that's like, and that's a lot. There's an enzyme in you, and that's why a lot of times we see in younger kids, we see ringworm in the hair in younger kids, but we don't often see it in adults. It's not that it does not occur in adults. It definitely does, but we more so see it in the younger population. And that's because there's an enzyme either present or not present. I can't remember which way it goes. And then it either turns on or turns off. And that's the reason why you stop seeing as much ringworm in adults as you do in younger folks. So I just want people to know that there are two different types of people in the world. Second of all, I loved all of the regiments that my comrades came up with, but my biggest issue with them, and I want to also put this out there, I suffered with athlete's foot, fungal nails, all of that stuff. So I take this very, very personally. I strictly only do surgery. I don't do any general podiatry, but the reason why the first product that I put out there was Fix Your Fungal Nails was because it was something that rang true to me. So a lot of these medications that are out there that are topical are really made for the skin, and they are just repurposed for the nails. So if you look at your skin, you can clearly see a pore on your skin, but if you take a look at your nails, even if I put my 2.0 readers on, I can't see the pores of the nails. So, so the efficacy or how well these medications work is really contingent on that they really kind of like just took something that was for, fungal infection for the skin, and they kind of like just repurposed it and relabeled it and made it and said, okay, well, we'll use it for the nail. One of the reasons why the Penlac, the cyclopyrox, I love that stuff. I think it's great. The gel especially. It works so well is because part of the instructions is to abrade the nail. Take an emery board and rough it up to what? Open up the pores so that the medication can actually penetrate. They're telling you our medication has pore penetration without telling you. If you're not really listening to what they're saying. So this medication that I have, which is called Fix Your Fungal Nail, is actually specifically made for the nails. It has a vehicle that's small enough to take the active ingredient through the pores of the nails, and that's why it's so effective. The other thing is that a lot of people are under the impression that fungal nails are caused by, a certain amount, a small range of fungus or yeast. And it's really a broad range. And it's also bacteria as well is included in that. Studies show that. And so the great thing about Fix Your Fungal Nail is that it's this broad spectrum. It will not only kill the fungus, it will kill the yeast, which is in the same family, and it will also kill bacteria. And so these studies that come out there, they say 50% is 50% of the fungal nail infections that they have out there comes back as a dermatophyte, but the other 50% is not. And within that other 50% that's not, I think like 34% is like bacteria. And then they break it down even more. The great thing about Fix Your Fungal Nail, like I said, it covers all of it. The other thing I want to stress to people is that the way a fungus survives, it survives by creating a spore. And a spore is this super hardy organism. And I know we talked about washing in really high heats and drying in really high dryers, but really, let's really be frank about it. You only kill a fungal spore under super high heat and super high pressure. You need to blast that little tiny sucker, okay?
Labrina said, boil it.
Yeah. And it's still really hard to even kill it with the boiling. You need some sort of that pressure activation. So what I tell people is that, yeah, you can be the cleanest person in the world, and if you do not keep up with a regimen of proactively protecting yourself from these spores, you're always going to have recurrence. It's always going to recur because there's no way for you to eliminate all the spores in your house. It doesn't matter if you get rid of all your socks. It doesn't matter if you get rid of all your shoes. That there's going to be a spore sitting over there in the corner, and here comes me, susceptible Dr. Ragland, and I step on it and put my foot into a shoe where it gets nice and dark and my feet start to sweat. Yes, they do. Well, I perspire, I guess, on my feet. But anyway, and that is the perfect environment for that spore to germinate or grow and blossom into a full-blown infection. So you can be the cleanest person on the planet, you can have an immaculate house, and you could still wind up getting a fungal infection, whether it's athlete's foot or if it's onychomycosis, which is the toenail fungus. I think that protection is really important. So my patients, I tell to use when I guide them to my product is that I say, okay, you're going to use it twice a day. And then once you get nail clearing, you're still going to use it, but maybe you can use it once or twice a week because it's very effective. It's very, very strong. You can really get away with using it once a day. Did I say that out loud? But no, you're supposed to use it twice a day. But it's very, very effective. We can't label that it works with nail polishes, but I have seen that I place it underneath, like I put it right underneath my nail, and then I put it right around the borders of my nails. And I find that I have not gotten any recurrence since I've started it this way, in addition to keep my feet clear of any sort of athlete's foot infection. I'm always prophylactically putting on some sort of topical. My preference is the cyclopyrox gel. I think it's great. If you have a sweaty foot, this makes sure that it keeps everything nice and dry. And I think there are two different types of fungal medications. There are fungicidal and fungistatic, and fungicidal kills it. Fungistatic kind of like, it slows it down. cyclopyrox is fungicidal. So I really, really like that medication. Yes. Now, if can we use the orals, or do I recommend orals? I think if it gets down into the nail bed, so if you have moons, those half moons at the bottom, we call that the lunular area. That is where the nail starts to grow from. Once the fungus has gotten into there, it's really hard for a topical to work. You really do have to get into the bloodstream. So taking something orally is definitely beneficial. But another thing I like to do is, another thing I like to say is the best way to get rid of a fungus is to get rid of the fungus. So oftentimes I will recommend completely evulsing the nail if it has that lunular or nail or down into where the nails start growing involvement. Let's take it all off. Let's be done with it. Of course, you always have to let people know that there is always a risk that the nail can get damaged with nail removal, but with expertise, this usually does not occur. We pull out the nail. Once it starts healing up, I tell them to start putting that Fix Your Fungal Nail right on it. And I love the fact that you said there's a fungus among us, because that is my jingle. It goes, there's a fungus
among us.
A fungus among us. So I'm so glad you said that. It tickles me that you said it.
So let me ask these questions. So now we've talked about nail fungus, we've talked about skin fungus, we've talked about treatment. So do you think, and I'll pose that question first to Dr. Hatter Bryant, do you see, and tell me, since you and Dr. Shabazz are doing more total care in terms of seeing a variety of patients, and Dr. Yolanda Ragland is doing more surgery, what are the percentage of people of color that you have in your practice? And do you think that nail treatments are harder to treat in patients of color because of maybe misdiagnosis, as we know that can happen, because of nail color that people think sometimes it's a fungus and it's not? Can you hit on that a little bit for us, Labrina?
Sure. My practice is majority people of color, brown, black. I have about 30% of others. And I just find that it's just not knowing, not taking care of. My biggest thing is getting them on board with their foot health and hygiene. Just being conscious about how your feet sweat, how they, I have patients who work in construction, and I tell them, your feet are going to sweat a lot. Some of them have to change their socks 3 times a shift just so that they're comfortable doing their work. The purpose of a sock is to pull the sweat off the foot and keep it cool. If you take your socks off and they're wet, the sock is not doing its job. So you need to switch it out. Now, I know they can't go wash their feet and they're on a construction site, but at least when they take their lunch, they can switch out their socks and do their second half of their shift more comfortably in their boot. And it keeps down odors as well. So I just think the hygiene is more important than anything. Not sleeping in socks is everything, because your feet need to breathe.
Please tell
If they're
your
in
parents
socks all the time, right?
Yep, tell your parents,
Or
because that
if you're in
generation
the
loves that.
shower, you're getting
Yep.
water. So when do they get air? You should have
Never.
slippers with the toes out, and you should let your toes get to the sunlight at least 10 minutes a day,
I agree.
naturally killing anything before it gets started.
Good old vitamin D. Dr.
Yes.
Shabazz, you want to take that one?
So I would say that for my practice, I have probably about 25% African American, and then the other 25% would be a mix of other skin of color, Hispanics, Indian, Middle Eastern, but majority of patients are Caucasian. I would say amongst, and I'm gonna say this in general, then I'll be a little bit specific with African Americans. In general, most of the nail fungus that comes through is a mix of infected from nail salon, infected from their own tools within
Don't tell
homes
me
that
about
are
the nail salon. Heaven
nail
forbid.
salon. Yes, yes, yes. Use patients kind of using the same tools within the family. You know, husband, wife, kids. The other aspect has to deal with just being very active in sport. You know, whether just recreational running, exercise, playing sport. And so, with that being said, Dr. Hatter Bryant made mention about hygiene is definitely key because that's going to go into the sweat buildup and the trauma stuff that occurs with a person being very active within the gym, you know, recreational, you know, running, playing sport and such. And so when a person comes in and they're very active like this, I'm like, well, outside of, you know, you using foot sprays, you know, for the sweating, uh, outside of, you know, trying to not reuse socks or use, you know, wicking socks in order to absorb that moisture, you know, wearing shoes that can be more aerated, whether it be their tennis shoes versus their casual shoes, like spraying, just as you mentioned earlier about spraying, you know, within your insoles of your shoes with Lysol or some other type of antifungal spray. It's like doing that kind of thing. But the other thing is too, anticipation that you're going to get rid of this. I tell them, I was like, well, there's a good chance that you're not going to get rid of it, but you can make things better. Okay. And because as long as you're going to run 5 miles a day for eternity, as long as you're going to, you know, play that sport, especially with even with young kids and teenagers, as long as you're going to, you know, wear certain styles of shoes, cleats and such, for baseball and football and softball and lacrosse, I was like, your feet or your toenails going to always be at risk of developing a fungus. And so even if we did this treatment, topical, oral, combination mixed in with laser, and that's why a lot of times too with laser, I don't really promote it a whole lot in patients that are very active like that, because it's like, you're going to pay me this money, even though I don't mind you giving it to me, but you're going to pay me this money. And basically, you know, you're going to get improvement, but then 6 months to a year, you're going to be like, well, it came back again. I thought you, it's like, no, I was told you, you know, it's going to make it better, but it's not going to really get, you know, cure it. So that's the thing that a lot of our patients, you know, have to understand is that, you know, the fungus is amongst us and it's a spore. It's very
It's
hard to
among us.
destroy. And as long as you have at least a percent of a fungus that's remaining, even though the nail looks great, it can always resurface itself and start causing problems. You know, so I think that's the biggest thing I'm more sure all of us are deal with is just trying to educate the patient about, yes, the problem, but also too their anticipation, you know, of what they expect or their expectations of just telling them, hey, you got this. If it's mild, yes, you have a better shot at really getting to a close to 100%. But in those in those moderate to severe, especially severe, when it's brittle, it's separated from the nail, and it's affecting, you know, majority of their toes. You know, I'll even tell the patient, especially for their hallux nails or the big toenails, you know, you might as well just remove them and do a permanent removal. And you get that side eye from the patients, especially the females, like, what? Remove my nail? Oh my God, I'm about to die. I can't use my foot anymore. It's like, no, it's just an extension of your skin. You can put a press on nail or something like that on, and if you know if you're that concerned. But the thing is that, you know, I get more males to probably, you know, be accepting of that than I do with the females. But that's an option in terms of you've been living with this. You've already used so many, gone through so many treatments, whether it be topicals, orals, and or laser. So it's like, you know, you can do this. And most women would say, well, I'll just continue to paint my nail. I'm not going to remove my nail. I say, hey, then, you know, so be it. But it's just the expectations that we usually have to let patients know. So hygiene is very important on top of just letting them know that, hey, we can make things better, but you may not necessarily 100% get rid of it.
So we're going into wrap up, and I'm going to make some comments. So want to give a shout out. I saw South Orange and friends from Femmes Noir Medical Group, which Femmes Noir Medical is a group of Black female providers in Northern Jersey. So hello, good evening. So we talked about what skin fungus was. We talked about what nail fungus was. We talked about treatment options that we agree with. We talked about Dr. Yolanda Ragland's fabulous line that she has. And if you have any questions, these are the times to ask. I'll say one thing that I do notice. I tell people, let's talk about the nail salon. And definitely a shout out to Queens before I do that. Yes, I see you. And the nail salon, because this is a hot girl summer. Hello, we gonna be in our cute shoes. There's a sale at DSW, Macy's every day. What are you talking about? You know, my high-end sisters at, Louis Vuitton and Gucci. What are you talking about? So I tell people, hey, you get what you pay for. One, better nail salons now have it looks like a shower cap that sits over the face, the basin that you put your foot in. If you're not seeing them washing out with soap and putting that, two, bring your own supplies. It's yours unless they're using an autoclave, which is a medical device that puts the instruments in and basically even higher temperature than boiling it, as we would discuss, and tries to kill everything. My salon does that. They already know who I am, so everybody's on point when Dr. Dakota walks in. So if you're not seeing those things, that's a problem. Three, you might want to get your own nail polish. Sometimes the use of nail polish from person to person can also be an issue that can spread nail fungus. So those are things to think about when you're going to the nail salon. Because I mean, even men, we bring, our boyfriends and brothers and husbands and fathers to the nail salons too, because it is relaxing and it does feel good. And you do get a little TLC and you do feel like, ooh, look at my feet after, what's been going on. But a good nail salon will also advise you things they can't do. At least in the state of New York and New Jersey, you're supposed to inform them that you're a diabetic so that they do not put anything that's cutting, right, Dr. Ragland? Nothing cutting, filing, but not cutting, because that can cause a problem in and of itself, which will be another show in the future. So keep those things in mind. So one of the big things as we're closing is where to find everybody. I need you to keep it to 30 seconds. And I'm going to start with, since we have our man here, my buddy, Dr. Zaki Shabazz. Dr. Zaki, if we're looking for you on social media to find you and you can name your practice, where can we find you, sir?
Well, unfortunately, I'm not as esteemed as Dr. Ragland and having a big social media presence. So that's still in the making. But I'm in Fairfax, Virginia. www.fairoaksfeet.com is my website. And if you're within the Northern Virginia area, you could definitely find me by just Googling Foot Doctor Fairfax, Virginia, or Dr. Zaki Shabazz, and I'll pop up.
Fantastic. In 30 seconds, Dr. Labrina Hatter, where can we find you?
I am located here in the nation's capital, and my practice is District Podiatry, PLLC. You can, my website is districtpodiatry.com. And on the website, you can find our new patient packet, as well as patient information. You can see pictures of the treatment room and all of those good things that you may be looking for healthy feet. Your feet are your foundation.
Thank you.
Right.
Dr. Yolanda Ragland, I know how to find you. Where can the people find you?
Okay, so my website is fixyourfeet.com. My flag.
I think you froze, Dr. Ragland, for a minute, but she's frozen. But definitely you can find Dr. Yolanda Ragland at fixyourfeet.com. She's everywhere. Tiara Toe, you can see her on that as well in terms of you Google that for surgical care. And I'm going to end with saying, oh, there you go. You're coming in and out. So I'm going to mute you because I don't think the connection is great. You can find me at Talks with Dr. D. I'm on all social media at Instagram, Facebook, LinkedIn. Talks with Dr. D is the umbrella organization for Stepping Forward with Dr. D. Next month, we'll be on talking about the state of Black residency. We're on the first Wednesday of each month at 7 p.m. If you want to find these great videos today and you missed it, you can also find it on my YouTube page, Talks with Dr. D, and each of these lovely podiatrists' social media. We thank you for tuning in. Shout out to Houston. We see you again. Shout out to everyone.
Yes.
Walk strong.
Thank you.